we'll talk about another sign in patients, and this sign is what is known as intermittent colicky pain. Intermittent colicky pain. So for the intermittent colicky pain, we're trying to now define what an intermittent colicky pain is. Of course, once you hear intermittent, it's something that is coming and going. Okay, colicky pain. They also talk about what could basically cause this type of pain. So for intermittent colicky pain, you should know that as a classic clinical sign, usually indicates that maybe there's a blockage, okay, in an organ in the stomach. Okay, of course, mostly the gastrointestinal tract. So the nature of pain, you're having sudden onset, sharp, cramp-like pain. So duration is that each episode can last seconds to minutes. It goes away, then it comes back again. That's why we say it is now intermittent. Okay. So cause we have smooth muscle spasms after obstruction. So sometimes the pain is relieved after you gas. That's or you stool. Okay. So intermittent colicky pain, what are the possible causes? Could be intestinal obstructions, could be gallstones, could be ureteric colic, that's things like kidney stones. Okay, it could be ovarian torsion, could be dysmenorrhea. Okay, because those could be caused by painful menstruation. There's sometimes functional bowel disorders. Okay, so have typical associated features here. So sometimes when you look at intermittent colicky pain, there are some other things you should look out for too. Okay, so that one you look at it when you get the notes. So clinical approaches, you have to take your history, where you know the location, what triggers the pain, the radiation. Do you understand? They do your physical examinations too. Okay, investigations, in the gastrointestinal tract, you do x-rays, ultrasound, CT scans generally. So management is, the person is dealing pain, so you have to actually relieve the pain, okay, by giving analgesics. Okay, therefore anything that is actually causing that intermittent colicky pain, you have to actually, how will I put it, you have to address it. So that's when they say you are addressing the underlying cause. Okay, so that's it for